Good morning, everybody. As I said, my name is Abimbola Odumosu, and I'm the lead advisor, the founder of KCF that has invited you today. And what does KCF stands for? KCS is Kedari Charitable Foundation, and we are an organization that commenced in 2005 years ago. And there were a group of us doing nice things together. I wrote a play and we were looking at staging Christian plays, but then we moved on to doing that to saying, I felt the Lord was telling us to do something about accountability, looking at the country, looking at how we can make a difference to the country. So we came together, we changed our name from RRHM, some of you must have seen our place, to Kedari Charitable Foundation. And we stand to be the voice, a very strong voice of personal accountability in Nigeria. As such, we have different programs that we run, and some of them we have programs for children. Do visit our website, and our website is kedarifoundation.org, where you will see all our different initiatives. We've written books for children to teach them about accountability and how they can learn. We have ongoing programs with secondary school children. Last year we had a very big school challenge that raised issues on accountability for secondary school children. We also have, what I would call our STAR project, which is our weekly encourager, which we write and send it out to everybody on a weekly basis in order to hone in your accountability principle and precepts and to work with it. There you will learn a lot of things about how you can build your own personal accountability from different people and different events across the world. So we try to make that very, very relevant. And in addition, we also have programs like this where we have different talks on different things that affect accountability. At least we have like about 3 or 4 talks a year. So earlier on this year, we have had one on May Day when we reflected on, the importance of accountability at the place of work. And we celebrated workers who have proved that they can live, they have proven themselves as accountable citizens at their places of work. And as I said, that was a May Day celebration. And now with the current pandemic, we now looked at the pandemic and we then looked at what's going on and knowing what resilience is to emergency preparedness and how it fits in together. Because if you have to be accountable for your citizens when you have a pandemic, then you need to have in resilience. I'm sure we'll pick all this one all along we go. But so far, this is just to sort of welcome you that Kedari, we are very, very, very happy that you are with us today. We are excited about it, and we do promise you that you have a very, very interesting session with us. So welcome everybody. And that's to welcome you to Kedari. And now turn over to Odumosu. Let him take us through the technicalities of operating the Zoom for this particular webinar. Thank you. Tolu, over to you.
Yes, thank you, ma'am. So everybody, welcome. Thank you again for being here. I just wanted to clarify that for the purposes of the meeting, because we have so many people online, we recommend that you don't even bother to upload your video. We're going to be focused primarily on the video from our panelists, and the panelists will have their microphones open. If you have questions, please post them in the chats. Mrs. Oluwabi will be parsing the questions and will raise them at the appropriate time. Otherwise, if you want to ask me a question, please feel free to send me a message on the chat privately, and I'll be able to respond to you if you're having any technical issues. But I believe that will make the entire thing flow well if most of us are just listening and watching, and the way we communicate back is through the chat box. Thank you very much.
Okay. Well, now I'm now going on to tell them why today's webinar. Yes. COVID-19, as we've seen, it's a pandemic and it's a global issue, and it has affected all of us, and it's still ongoing. And right now, the figures in Lagos State is between 450 to 600, and we monitored it for over a week. And now the question that I'm sure a lot of you are asking is, you're doing this for medical workers. As I briefly explained, resilience and an emergency, they're intricately interwoven. If you need to respond in an emergency, either as a leader or as even the head of the household, or even as the government, your ability to put in systems so that you need to continue to change your system, modify your system in order to make sure that you respond, you work with that system, and then you are accountable to your benefactors. So whether you are an NGO, you're a government, you're that. So it's looking at that ability to bounce back, to respond, to keep going despite all difficulties. And that is why we said that, we really need to take a look at this subject in depth. And then we now also look at the idea of who has it hit most. I'm sure a lot of you know that, yes, people are dying, people are recovering, and then we thought we'll look at it from the health workers approach. So this afternoon, we are going to be looking at the resilience building from the point of view of all the health workers that have kept on going. And at this point in time, I would always like to say that, this week, at the beginning of Monday, we lost a very, 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 I would say, important person in the medical field in Nigeria. His name is Professor Lovett Lawson. He's the MD director of Zankil Hospital in Abuja. And one of his staff are with us, Dr. Oro Oban. Imagine what it was, or it's still like, for all the medical workers in that hospital, definitely over 100 workers. How have they have to cope? They hearing the news that the MD has died of COVID-19, they have to go back and look after the patient and keep going. So we thought that this is a fantastic skill to learn from them. But also, the second part of this session is that we are going to be thanking them. We're going to have a session where we would open up everybody's speakers, and we will be able to say thank you to all the workers, the medical workers, the doctors, the nurses, the pharmacists, the administrators. The administrators are not on our panel, but on their behalf, we're going to thank everybody for doing a fantastic work, for helping people to recover, and for keep going despite this very, very, very dangerous situation. So please, can I have the agenda? I would quickly like to talk us through the agenda for the day. Tolu, please bring up the agenda. Tolu? Okay, thank you very much, everybody. It seems as if we're on the opening session, which we have had, and so the rest of the agenda will be, if I can go down, I'll go on to introduce the facilitators and the panelists to you, and then I'll hand over the microphone, the session, to our very renowned Professor Elizabeth Arumadisu, who is the head of the newborn department, to go through the discussion with all the different people that we have on board with us. And going after the discussion time, we're going to go into a question and answer time. So please post all your questions onto the chat to everybody. Mrs. Tony Oluwabi, she will compile them and share it with Dr. Disu and Professor Disu, and he will then send it to the appropriate person. And after that, we're going into the session, which I've told you, is the thank you session, which will be led by another prof, Professor Kayode Denloye. And then I'm going to round up the session about talking about KCF and our future webinars with you. So, so thank you very much for that. So can I have the slide on who is who for this particular session, please? Okay, no, so look, I have it. Can I share my screen?
Yeah, you can share a screen. You have the ability to do that.
Okay, just a minute, please. Can you see me? Can you see the screen?
No, not at the moment.
Okay. Okay. And share screen. Okay, can everybody see my screen, please?
Yes, we can.
Okay, thank you. Okay, today I just want to go through for everybody who is here to learn about the panelists that we have for today. At a glance, we've all seen our flyers. Our main facilitator for today is Professor Elizabeth Disu. Professor Elizabeth Disu, she is currently the head of the Department of Pediatrics and Child Health at the Lagos State College of Medicine, and she's also one of the founding staff of the unit. She's had the privilege of being head of the department for 2 terms, and overall, Professor Disu has over 30 years experience as a consultant pediatrician and neonatologist. She was one of the pioneering graduates of medicine from the University of Jos in Nigeria, and she undertook her postgraduate studies in Lagos State University, Ikeja, and she has worked at Mercy Street and the General Hospital. Professor Dr. Disu wears several hats, and one of them is that she's an examiner for the West African College of Physicians, and she has several published papers. She's also on several members of many committees at her place of work at the Lagos State and the Lagos State Ministry of Health. As I said, she wears many hats. She has diverse work experience, including directing and facilitating numerous training workshops in HIV/AIDS, breastfeeding, neonatal resuscitation, and helping babies for organizations such as WHO, UNICEF, Save the Children, Latter-day Saints, Federal Ministry of Health, and she's a national trainer for essential newborn care. She's also an elected member of the American Academy of Pediatrics, and drawing on her international contact, she established the annual National Neonatal Resuscitation Training in 2008 and was the national coordinator for the first decade. But most importantly, she has a passion for maternal and child health, and this led her to establish the ABIE Maternal and Child Health International Foundation 4 years ago. And I would also like to add that Professor Elizabeth Disu is also a member of this charitable, Kedari Charitable Foundation, and one of the founding members. She's well-traveled and she's happily married with 4 children. Thank you, Professor Disu. Thank you for honoring us by accepting to chair this session with us. And now, moving on, I now want to bring to you Dr. Obon Orok. Dr. Obon Orok, welcome. Thank you for joining us. And she's a consultant, a family physician with Zankil Medical Center in Abuja. Dr. Orok has interest in health policy and management. She's a member of the Zankil Hospital Infection Control Team, and she has been instrumental in steering strategic direction to create awareness, train, and implement health policies. Dr. Orok, welcome to the team.
Thank you.
And Dr. Ademola Denloye, he's the current managing director of St. Luke Hospitals in Yaba, which was established in 1966, and he's a former director former advisor to the Methodist Church Nigeria, where he supervised the Nigerian Healthcare Foundation project of rural health facilities across the Methodist Conference in Nigeria. So he traveled the length and depth of Nigeria. And recently, he's the lead professional in the St. Luke's Hospital Consortium that won a bid to rehabilitate, equip, staff, and manage the General Hospital Obudu in Cross River State as a private partnership venture. Thank you, Dr. Demola Denoye. Welcome. And now I go to Dr. Bamidele Mutua. I'm sorry if I got your name wrong, just forgive me. I'm ever so sorry. But Dr. Mutu is a very, very busy man. He's the director of the Lagos State Biobank. So thank you for sparing your time to be with us today. We really appreciate it. And he's a clinical microbiologist and infectious disease outbreak responses since 2012. He was and is still lead physician during the Ebola outbreak of 2014 and Lassa fever in 2016, and is still at the forefront of the COVID-19 response. We are really grateful for you sparing your time to join us here. Thank you very much, and we look forward to it. And now I go to our beloved Dr. Ngozi Onya. Dr. Onya is also another, everybody here, they're all fantastic people, I must say. And she is now heading the head of Pallium Memorial Hospital that has been given the license to treat COVID-19 patients privately. But before that, she graduated from the University of Ibadan, and she's a fellow of the West African College of Physicians. If you can manage a big hospital that is responding to COVID-19, definitely you must have some management skills. And she acquired this management skill during her 10 years work with as the company medical advisor to the Nigerian Bureaus. Thank you very much, welcome. And you all have their bios, so I'm not going to read all of them. I'm going to highlight the main points. Dr. Ngozi is very well known for her passionate approach to her work, integrity, pragmatism, resilience, persistence, and demand for efficiency, quality, and ability to execute. Her personal statement is service to God and humanity through professional excellence and dedication. So Dr. Ngozi, thank you very much and welcome. And she doesn't come alone. You know, the doctors, they work with nurses. So she's got her nurse with her. We have Mrs. Erima Unwanma. She's a registered nurse midwife with the Pallium Memorial Hospital for over 6 years. She's the head nurse, and she's currently working in patient preventive care. I've spoken to her. She's a fantastic person, and she's been involved in looking after the COVID-19 patients. Thank you. Now we move on to Dr. Adedapo Denloye. Dr. Adedapo Denloye is a graduate of the Obafemi Awolowo University, and he left for the UK. So he's now working with he's a registrar with St. Helens and Knowsley NHS Foundation Trust. We felt that since this pandemic is kind of global, we shouldn't only look at what's happening around us in Nigeria. We should touch base with what's happening around the world. So we brought on Dr. Adedapo Denloye to share with us his experience in treating COVID-19 patients from an NHS Trust point of view. Unfortunately, in Nigeria, we don't have such a thing as an NHS Trust. We wish we could. We hope you can help us to create one. So I move down to Dr. Suella Adekoya. Dr. Adekoya is a medical director of the Community Health State of Virginia. So she's going to give us the state aspect of achieving resilience during a pandemic such as this. Dr. Adekoya is professionally, she's an obstetrician and gynecologist, and she's completed her master's in public health degree, and that's why she's head of the medical director. Well done for a Nigerian to achieve this status in the USA. You know, we say thank you, Lord. So thank you for joining us, and we look forward to having you on board. Now, I'm moving on to, so we've now had doctors, we've met nurses. So are there other people also in the medical workforce? Yes, there are. So we are now going to introduce to you a very passionate person who's very passionate about her work, and hardworking and dedicated pharmacist, Mrs. Bisi Bright. She's the Chief Executive Officer of LifeWell Initiative that are focused on healthcare education within Nigeria, outside of Nigeria, in Africa, and so on. She's like many of us on the panel. She wears several hats. Her bio that she sent, you all got it. I'm not going to read it up, but I'm just going to highlight a few of her achievements for you. She's the vice chairman of a self-sustaining non-profit healthcare social enterprise, which she has said has impacted over 1.8 million Nigerians and thousands of Ghanaians. She's also a member of the Nigerian Stock Exchange Graduate Management Training Program. Of course, knowing somebody like her, she's also global. At the global level, Mrs. Bisi Bright, she was ESCO member for Africa and the Middle East at the International Pharmaceutical Federation. She's a twice member of the Nigerian Stock Exchange Graduate Management Training Program. She has authored several published articles, some of which are in peer-reviewed journals, and she has supervised over 20 postgraduate and project theses, and one of them is currently ongoing at the University of Helsinki, Finland. And Dr. Sorry, you will with all done, you will get a PhD. She's also a deputy national coordinator of the National Hepatitis Coalition in Nigeria. She's very, very keen on hepatitis, and they've done a lot of work on that. And now with respect to COVID-19, she's developed protocols for treating COVID-19, which has been widely used by several doctors. She's partnered with several medical doctors to conduct a lot of her programs, be it hepatitis E and be it COVID. So she comes to us with a wealth of experience and diverse wealth of experience at that. So Dr. Mrs. Bisi Bright, welcome. We welcome you. Thank you for sparing this afternoon some of your time to dialogue with us. For those of us who want to read her, I have already sent out the bio yesterday because I felt they are so rich. We do not have the time to go through it all, but please do go through it and enjoy what she has done as a Nigerian. It's really noteworthy because she runs a non-funded NGO. And she doesn't come alone, like the other doctors as well. She's bringing with her today two nurses. One is Mrs. Abigail Peterson, okay? And she is a nurse practitioner with extensive public health experience and works in the hepatitis team as a trainer, tutor, and vaccinator. And then she comes on with, we will pass that. She comes on with Mr. Femi Oguniyi. I don't have his picture, it was a last minute thing, but he's with us. He's a double qualified public health nurse at LifeWell, and he's a front worker treating COVID-19 patients. So Femi Oguniyi, welcome. We're really glad to have you with us, and we look forward to a very useful and a very interesting panel discussion led by Professor Elizabeth Arumadisu. Professor Elizabeth Arumadisu, I now hand over the panel discussion to you. Thank you.
Thank you very much, Dr. Odumosu, for your kind words. Can you hear me? Can everyone hear me?
Yes.
Good morning and good afternoon to all our panelists and participants, wherever you are. I warmly welcome you all to this webinar and thank you for taking out time to be with us today. It's going to be a very interesting time because of the topic that we have to discuss today. COVID-19 has actually dealt a devastating blow on mankind, and it has changed the way we live, the way we think, the way we work or relate with one another. It has also affected our healthcare system tremendously. We have seen all over the world that a lot of healthcare workers have died in their thousands. In Nigeria, we have over 800 healthcare workers who have been affected, infected or had this been positive since at the last count in June. So it's really something that has affected everyone. And in Lagos State being an epicenter, we have about over 500 healthcare workers affected, with about 70% of them, fortunately, mild symptoms or asymptomatic. But unfortunately, we have had, sadly, about 8 deaths. So it's, but however, people still go to work, people still put in their best, and they are not, they're unmindful of all the dangers, even though we have had incidents of people being afraid. There's anxiety, there's also panic attacks, and we have learned about somebody even committing suicide. So today, we are going to see how these distinguished panelists will tell us their challenges, how they have surmounted these challenges so that other healthcare workers can learn from their experience. And how are we going to do that today? Well, we are going to pull in our distinguished panelists to recount their experience using a patient care flow method by going, first of all, in 3 categories. We are going to look at the local aspects, then we'll go on to the international aspects, and then the non-clinical aspects. So we will start off with the local or the Nigerian perspective from the private, then go to the public. We know that the healthcare delivery system, particularly in Lagos State, is run, 60% of it is provided by the healthcare sector, by the private healthcare sector. So private healthcare has a tremendous influence onto the health of the Goshians, and I must say maybe the rest of the country. So after we've heard from the private, we'll go on to the public, and then we'll now go international to see what is happening and how they are coping with these challenges in the UK as well as in the US. So before we now come back, we want to have an insight and holistic insight into this topic. So we will take some non-clinical perspectives on education and mental well-being. So we will conclude with participation from our audience, as we will also want you to give us your perspectives and ask questions. So please use the chat box to let us know what your questions are or what your comments are. So without much ado, I'd like to call the first panelist to take the floor. And that will be somebody, like I said, from the private sector. I'd like to call on Dr. Okong Orok, who is consultant with Zanklin Private Hospital, Abuja. Please, can you tell us, as a consultant in a private hospital, can you describe how you cope with this present COVID-19 problems? I would also like, in the same vein, for you to tell us the challenges that you're experiencing and the measures that have been put in place, or you are putting in place to combat these challenges. Thank you, Dr. Orok.
Thank you. Good day, everyone. Can you hear me?
Yes, we can.
Okay. Good day, everyone, and thank you to the facilitators for the opportunity to be here and to share our Zankli experience. So as a private hospital, we basically do not treat COVID-19 patients, confirmed COVID-19 patients, but we are aware of the fact that we have lots of patients coming in with COVID-like symptoms. So how have we been able to cope with this? During the initial, when the pandemic started, Professor Lawson graciously was able to pull resources together and to put things in place. He provided personal protective equipment. We revamped our hospital infection control committee, where we set up protocols to be able to screen and triage patients who come into the hospital, having in mind that we have lots of patients coming in with these symptoms who have been with us for a long time. So we had protocols where we do primary and secondary screening. We involve the clinical and non-clinical staff. So after the primary screening, the doctors will come in and then do a secondary screening. Professor Lawson also provided us with a holding tent, which I had a picture here. A holding tent, a two-bedded holding tent, where we usually keep any patient that we are suspecting has COVID-19. So we do this and then we keep these patients here ideally for about 24 to 48 hours, hoping that we'll get the NCDC to come and test these patients. We offer them emergency care and then we send them home, or we send them to the designated COVID centers where treatment is being offered. So as the pandemic also intensified, we also made some other adjustments to our consulting rooms, structural adjustments, just to help us to minimize the risk of transmitting this to our healthcare workers. So what are the challenges that we've experienced so far during the course of this pandemic? Initially, we had problems with adaptability to protocols by staff. Seeing that this is new, it was so difficult for most of our staff to adapt to these protocols. But because flexibility is part of resilience, we had to look for communication strategies in order to let them know, that this is really important. So we had to do open meetings, trainings, and then share information via emails, and then we kept monitoring. And with time, the staffs were able to come in terms with it. We also had to restructure our health systems. We looked at the service delivery, we looked at the health workforce, and then we also looked at information dissemination. So for service delivery, we looked at options such as moving to telemedicine, and then we also looked at the cost implications of all this. For the health workforce, we initially restructured our staff schedule across all the departments. Provision was made for transportation. We had one-on-one counseling with patients, and we also made sure that we provided testing across for all cadre staff. Information destination, as I said, was created, and then we were able to engage the staff in any form that we can. So these are basically the things that the challenges that we had, and then the way that we were able to cope with this. Another challenge we had was also testing. It was quite difficult, initially, for us to have testing done as prompt as possible for us to make quick decisions for our patients. But I think during the past couple of weeks, the government has been able to expand testing centers. So we are having the turnaround time is becoming shorter. Thank you.
Thank you very much, Dr. Orok, for that in-depth insight into the patient's pathway that you have. In terms of your medical doctors who had problems adapting to the new curriculum, it's nice to have protocols, but what did you do about adaptation? How did you help them adapt to the new protocols?
Like I said, we had a series of meetings, trainings, sharing information. We had one-on-one counseling with most of them. We had information shared on every system. We kept monitoring. That's all we had to do, kept monitoring, sharing the information on social media platforms that we created. And then over time, they were able to adapt to this.
Thank you very much. Is there any one lesson you would like to share with the participants to take away this afternoon?
Well, for me, as a facility, we've actually gone through a lot during the past few weeks. But I would like to tell everyone that we need to be optimistic. Okay, we need to be optimistic during this current pandemic, and we should also know that resilience during this current pandemic is a shared responsibility. We all owe our patients the ability to commit to whatever we are doing. I know that we are all going through periods of depression, anxiety, burnout, but we need to commit to the people around us rather than pull out, and stay committed and try to reduce the level of stress that we go through. Thank you.
Thank you very much, Dr. Orok. Let us move down to our next panelist. That is Dr. Ademola Denloye, who will be giving us his own perspective from the medical director of another private hospital now in Lagos. Dr. Denloye, would you like to tell us the strategies that you have used to build resilience into the healthcare system in your facility, particularly addressing the issue of reproductive, maternal, newborn, and child services during the COVID-19 era?
Thank you very much. Good afternoon, everybody. I'm glad to be here to share a few words with everybody. We run a facility in Yaba, which is of course much smaller than Zankli in Abuja. And initially we had to almost stop activities when this crisis started. But then we realized that we had a lot of other patients who needed help, especially the antenatal patients and patients who needed to have emergency cesarean sections and who had to be delivered of their babies. So the first thing we did was to develop strategies to try and make sure that we didn't inadvertently admit patients with COVID symptoms. That was in the initial stages where the numbers were quite low. So we were able to triage the patients, and as much as possible, we kept the patients with fever out of the hospital. The second thing was that we, because it was a smaller outfit, we were able to manage patients who came to the hospital without allowing them to come into the hospital. We could dispense some medications to them, but we had no choice but to bring in the antenatal patients to have the babies. And during that period, we had 1 or 2 cesarean sections that needed to be performed. But fortunately, we didn't have, and we have not had any issues with inadvertently treating COVID patients. We had participated in an infection control protocol a couple of years ago. So we had some bit of experience in infection control practice. But as the Dr. Obon reiterated, you always have issues with staff who find it a bit difficult to follow new protocol, hand washing, sanitizing, social distancing. But by and large, we managed to get by. We have not bought PPEs in the sense of the overalls, but of course, we have provided face masks, sanitizers, gloves, and followed standard infection protocols. The major challenge we had initially was that the cost of everything skyrocketed by 300 to 400%. And most of these things were difficult to get. There was a lot of panic buying, but at the end of the day, we made sure we had enough supplies to make sure that we were protected. The second thing we then did was, at the second phase of the crisis, we now realized that we were getting patients with midlife symptoms because of the inavailability of testing. And of course, we all know what testing procedure is. It takes a couple of days for us to get appointments for testing, and the results come out 5-6 days, sometimes weeks after the tests have been done. So we needed to devise a way of going around it without waiting for the test. So we developed our own, something like a COVID score, to try to assess which patient would be allowed in the hospital, which patient would be asked to go home, to go and self-isolate, and then book for the tests in case the symptoms got worse. So we've been able to manage a few of the patients from their homes with specific instructions on what to do, and some of them have been given handheld pulse oximeters so that when their symptoms get worse, they can get admitted into the hospital. Our hospital is not that large, so we really don't have a space to create a tent to keep patients. So we've never really kept any patient on the wards, but we've been able to look after quite a number of patients who have inadvertently walked in. And the experience now is that quite a lot of people are phoning in to describe their symptoms, and we've been able to give them instructions on the phone as to what to do, book for a test, watch your symptoms, get a pulse oximeter, and by a large extent, most people have been able, and of course self-isolate, most people have been able to manage their symptoms. We've had just 1 or 2 very ill patients who have had to be admitted into public centers and 1 or 2 in the private centers. But so far, so good. We've also tried to use some preventive protocols. Apart from the PPEs that we use, we've decided that we would staff some measure of some medication on a monthly basis as preemptive prevention, because we believe that the drug protocol is effective, especially in the early stages, and that if you take these drugs, which most of us are aware are quite useful. So we provided this medication for most of the staff so that we reduce the risk of infections and risk of spreading it. We've also encouraged members of the public who have been in contact with positive patients on what to do. And finally, we've been able to encourage positive patients at home to self-isolate and manage themselves. So by and large, it's been quite tough. It's been difficult, but we're trying to keep the place open. As for the staff, Of course, initially too, we had to reduce the number of staff coming into the hospital. The rosters had to be changed to make sure that the first it was shut down, so it wasn't easy for them to come to the hospital. So we had to structure the roster and reduce the number of times they have to spend on the road. In fact, at a point in time, we had only staff who lived close to the hospital, who could actually walk to the hospital, because public transportation was difficult and it wasn't just available. So as far as that is concerned, we're still trying to restructure the roster and the attendance of the workers such that we reduce their own risk, because we don't have to look at patients alone. We have to look at how do we reduce the risks of our workers too. And some of us have also decided not to go to work every day just to reduce possible exposure, especially when you're in the wrong age group. People who are over 65 with pre-existing conditions are at serious risk, and it's better for us to protect ourselves. Like somebody said, there's no emergency in a pandemic. Everybody has to, safety is the watchword. You have to stay safe. You've got to do things that make sure that you reduce the risk of exposure and infection.
Thank you very much, Dr. Deloye. That is quite extensive and in-depth. And you have highlighted, besides the protocol issue that was mentioned earlier on, which you also have, you've highlighted triaging and trying to separate patients with comorbidities, and also gone to your staff as well. Thank you for your good work. I would like to come back to you later on to ask about advice for fellow MDs of other hospitals, and also advice to the government from the perspective of a medical director of a private hospital. But because of time, let's quickly go on to the public sector now. And I'll be pulling in Dr. Bamidele Mutiu. Dr. Bamidele Mutiu, thank you for coming. We know you're very busy working at the largest COVID center in the country, the Yaba COVID Center, and you have vast experience. Thank you. Could you briefly describe to us your role and challenges you have faced in responding to COVID-19 pandemic from a government hospital perspective? Thank you. Dr.
Thank you very much. Good day, everybody. I'm the director of Lagos State Bank, and I've been in the response since February when we had the index case. And one thing that we've seen all along is the issue of preparedness. One of the things that has made Lagos to be able to to have a favorable outcome has been the level of preparedness. 40% of COVID samples in Nigeria are treated in Lagos State. And I'm a member of the laboratory pillar, as well as I'm also a member of the case management team, as well as infection prevention and control. When it comes to my role, as the director of Lagos State Biobank, we oversee the issue of sample collection and processing. Initially, during the outbreak, there was not so many people who are ready to go and collect the samples because of the issue of the fear and the stigma attached to COVID-19. So occasionally, I find myself on the field, and I could tell you most of the time with my team, close to 80% of the samples that we brought in were positive. So then one of the fear then was when, not if, I become positive, was the question that was the mind of everybody then. Then apart from that, we made sure my other role is the issue of training. After some time, we had to start a building capacity. So I was involved in training of those who will collect the samples, apart from infection prevention and control. Then aspect of case management. Incidentally, I came in to meet the first case, the index case, because I was away for about a week attending the WHO training of trainers on case management of COVID-19. So I resumed and met the first case, for the index case in Nigeria. And by and large, all along, I've been involved in diagnosis, monitoring of the patient, as well as discharge. Then the issue of changing the case definition, who are involved in all those aspects as well. Then training in case management of COVID-19, making sure we cascade it down. What are the challenges? That's the aspect I'm really going to look at, is the issue of preparedness. Even though Lagos State was prepared, because after Ebola in 2014, there was a committee that was set up, and we look at our gap. We look at the gaps, and we decided what are we supposed to do. So as of January, after the declaration of the epidemic, the COVID-19, we were already monitoring the trend all over the world. When the first case was recorded outside China, when it outside Europe, other zones, we were already prepared. But what we discovered at the end of the day was that we were just about 60% prepared. We never expected the magnitude of what we saw, even though we had some reagents on ground. Dr. Denloy was talking about the issue of turnaround time for laboratory results, because we had the stockouts and there was a pandemic lockdown. So goods, consumables were not coming in. And also bearing in mind that molecular diagnosis is the bedrock of COVID-19, everybody is going to the same market for the same commodity. So it becomes issue of who has the financial strength, who is able to, who has the logistic strength for us. So that was a big challenge. The issue of consumables was a major challenge. Then the issue of even having healthcare workers who will be ready to work. So at the end of the day, we had burnt out syndrome among all the healthcare workers. There's psychological impacts in which since February, I think I've seen my family maybe twice or thrice. Most of it I know we do video call because of the fear of getting them infected. So, and this is the longest time I've ever spent outside my home. Then the work overload is there. In the lab, I work from 7 in the morning to 11 p.m. Those in the case management, they do shifts, 12-hour shifts. So those on the field, you never know when you're going to come back in. So those are challenges. Those are some of the things that we discover. What measures have we taken to build resilience in our staff? Even though there was fear, even though there was that fear that we could see in the faces of people, the first thing was the issue of risk communication. The risk communication pillar was strengthened to make sure we are able to, allay the fears of the people. Then capacity building was another thing that we did all the time, training and retraining. Then the availability of psychosocial support for the people, not only the patient now, even the staff. There was a time the psychosocial support had to come to the lab to talk to the lab team and everybody involved in response. At one time or the other, I've had 1 or 2 or 3 sessions with the psychosocial support pillar. Now, building resilience, pre-COVID, we had been training ourselves in biosecurity, biocontainment, and the rest. There's a team for that for Lagos State. And then during the COVID era, we still continued with training. There was capacity building, psychological support. Welfare is also a major issue. And I can tell you in that aspect, at least you still have 2 to 3 square meters a day. Most of the workers who responded were accommodated by the Lagos State government. Then the recognition by the Lagos State governor during his 1 year in office plays a major role in even increasing the resilience of the workers when he dedicated his first year in office to the frontline healthcare workers. That was a major morale booster for members of the, for those that are in front line. The challenges will always be there because when you thought we are reaching the peak, we just discovered that the cases are coming. When we open up and we started doing active case search, now we discover that we have so many in the population. So as of now, we are just climbing. We've not really reached the peak of the epidemic as far as Lagos State is concerned. And we know that the Nigeria data, Nigeria response will be based on what is obtained in Lagos. So then what would be the message that we want to pass across? So one lesson for the participants is that when it comes to resilience, when it comes to success, it's like the tip of an iceberg. Beneath that tip is a layer of preparation, training, commitment by the government, funding, partnership. We are lucky that we had a partnership with Global Global Emerging Pathogen Treatment Consortium, as well as GPP Canada. So Lagos was able to be strengthened a bit before this outbreak. If not, we have been running around like other states. Now, as of now, in Nigeria, the lab that I am the director, we'll be able to ramp up our capacity from 96 tests per run to 680 tests per run. So if given the challenge, we are able to produce close to 2,000 results per day from Lagos State Biobank alone, not to talk of the peripheral laboratories that we've brought in. Then also we have empowered the private laboratories. Some of the private laboratories have been validated to be able to do COVID-19 tests, so that at least the capacity of testing in Lagos State by the end of this month should be close to 5,000 per day. So with that, I believe we are strengthening the system. Thank you very much.
Thank you very much, Dr. Mutiu. That was quite illuminating and very insightful. Thank you so much. But you have described a very tedious work hours and schedule, and you talked about welfare package. Do you think that the welfare package for workers is adequate in terms of building resilience to the, for the healthcare workers as it's currently being observed? You agree that there has been strikes within the public sector in recent times. What would you like to make comments on that briefly?
Yeah, thank you very much, man. The welfare package can never be enough, but we have to look at it that healthcare in Nigeria is out of pockets. Now for testing, it's from the government free of charge. For taking care of the patients, for providing accommodation, feeding, everything. When you sum everything together, even whatever amount one is paid at the end of the day, since the salary has been going since February, for those that work in the public sector, we have been receiving a salary since February. We have to balance everything. If not, at the end of the day, we're going to run everything aground. So the welfare package, people may look at it as not being adequate. But if the government decides to give a lump sum and say, okay, go and take care of your own accommodation, take care of your own feeding, it will have been another thing, because during the lockdown, there's no place you could get food to eat. So, but the government was able to provide food for us, 3 square meals. They were able to provide accommodation for us in hotels that were permitted to open. So by and large, I'll look at it as a call to service, not really to enrich ourselves. So the welfare package, as far as I'm concerned, is still adequate with what the government has been doing. Thank you, ma'am.
Thank you very much. Thank you. Just one last question. You mentioned psychosocial support. Sooner or later, I think many more hospitals will be treating COVID patients. Do you think we should pay attention and any need for expanding this psychosocial support to other hospitals, because we do all see them all, whether asymptomatic or pre-symptomatic, they are there.
Yeah, the role of psychosocial support is germane, it is crucial. And as we move to home-based care, the psychosocial pillar has been strengthened. We are going to expand them, that pillar, so that at least even for those in private hospital too, they will be able to access that psychosocial support, because it's a very, very crucial. Some people are going through burnt-out syndrome, stress, fear, all those ones. But the psychosocial portal has been able to prop up the healthcare workers as much as possible. So I believe the psychosocial support will be expanded and will be extended to those in the private sector as well. Thank you.
Thank you very much, Dr. Mutiu. We'll come back to you again if we have time, but we must move quickly to the next speaker. And the next person we have is Dr. Ngozi Onya. Dr. Ngozi Onya, you is the founding partner for Pelon Memorial Hospital, a private hospital in Lagos that has Lagos State approval to treat COVID patients. Please, could you tell us how you achieved this feat and what obstacles you had to overcome to get to where you are? Dr. Sonia, can we unmute Dr. Sonia?
I've unmuted myself. Good evening, everybody.
Dr. Onya.
And thank you for, yes, good evening, everybody. I've unmuted myself. Can't you hear me? Can you hear me?
We can hear you now, ma'am. We can hear you.
Yes, good evening, everybody. And thank you
we can hear you. We can hear you. Go ahead.
Okay, thank you for inviting me to speak on this panel. The first thing I will say is that my journey to managing COVID as an illness, or my journey to the role I'm playing now in this pandemic, was in a very serendipitous manner. It never occurred to me for 1 minute as a doctor running a hospital that we will not treat COVID. We've run for 10 years. We have existing patients. So what if our patients fall ill? What will happen to them? So from the beginning, I realized that we were not going to be able to escape treating COVID. And so we were prepared as an organization for treating COVID. My first patients presented on the 23rd of March. And she presented as a critically ill patient. And because we have a critical care unit, she was admitted straight onto a ventilator. She had been seeking care all over Lagos. It's a long story. For more than 13 days before she found her way to our hospital. Interestingly, she wasn't an existing patient. And so she came into the hospital. At the time she came into the hospital, we had just closed our Ikeja branch down because we have 2 branches in Lagos. Victoria Island, which is our main branch, and Ikeja, which is the newer branch, and not an outpatient clinic. But it was actually a hospital which we had converted to an outpatient clinic. And so we closed our hospital in Ikeja on the 1st of April. And chatting with the son of the lady who was my first patient, he said to me, instead of closing your hospital down, why don't you convert it into a treatment center for COVID? He says, for 13 days, I was looking after my mother myself. He's an engineer. I had oxygen, I had everything in my house. And doctors were coming to set up IV fluids in my home. He said, you'll be able to help patients like that. And I thought to myself, that's not a bad idea. And then he said, the most important thing, he said to me, I will support you. So it brings us to the first obstacle. If we can go to my second slide, the first obstacle, of course, was the issue of finances. The costs of running a hospital are very high. People don't see that. So most hospitals, and I'm sure the other medical directors on this forum will agree with me that most hospitals are not very profitable at all because of the costs. So the revenues will increase and they may be high, but profits are very low. So cost was my big challenge, finance. But he said to me, I will support you. I hope he's listening to me because I invited him to this program. So his company is Sackville. And then another big company, which I'm going to give credit to this evening, IHS, had previously approached me to say, we are willing to help you increase your capacity to treat critically ill patients if you will guarantee that you will look after our patients if they fall ill. So I reached out to IHS. And to cut a long story short, between Sackville, IHS, and a couple of my personal friends from Lagos Business School, where I did my MBA, so my MBA classmates, we were able to set up to repurpose our Ikeja hospital for the treatment of COVID. So that was one big obstacle that was surmounted. The second obstacle was, of course, getting the buy-in of our people. So first of all, the staff. But from the beginning, I made it clear to the staff that there's no point enlisting in the army, and then when there's war, you decide that you don't want to fight. We're healthcare workers. We signed on to be healthcare workers, me 38 years ago when I took my physician's oath, and this is not the time to chicken out. And I made that clear to the staff, and I said, I also gave them the option, anybody who was afraid should step aside. 2 young doctors did, but everybody else signed on, and we all agreed that we will stay and do the best we can. And we did a lot of the things that have been shared already on the platform by, for example, the doctor from Zankli. So we set up protocols, guidelines, we put up a triage system, and so we bought PPEs to make sure we protected everybody. And the staff, no button. My family and friends, I've seen my brother on this forum, we're all a bit horrified because I'm also in the age group that is not very young. And so I got a lot of pushback from family and friends, but I stood my ground and I said, imagine if Cameroon decides to attack Nigeria today and then the generals decide that, sorry, we are too old to fight. They're still in the army. They cannot do that. So in the end, I got the buy-in of my family and friends with a lot of prayers. My colleagues, that was the most disappointing part. I got too much pushback from my colleagues, too much pushback. It was disheartening to say the least. I had to say to one of them, you have chosen not to manage COVID. I respect your choice. Please respect my decision to manage COVID. All kinds of motives were ascribed to my decision to manage COVID. So that was one big challenge. My colleagues, that was very disappointing. And of course, my partners, my hospital is a partner, there are 6-7 partners that run the practice. But yeah, it was easy because we share the same values and the same views. So they got on board quite easily. Then getting accreditation from Lagos State government was the third biggest challenge. So having started, and from the beginning, I notified Lagos State government that I was planning to do this, and I was encouraged to go ahead. But I guess we suffered from being pioneers. So the other facility that had been accredited before us was accredited in a roundabout manner because a high-profile patient was rushed into the hospital. So the government accredited them with ease. But I think we were the first establishment that was accredited through a process, and the process was being developed on the go. As we all know, this is a novel virus, so also Lagos State was not, I mean, this was new, so everybody had to start from scratch, building up protocols and procedures and so on and so forth. So it was a really, really, really hard battle to be able to finally get Lagos State to accredit us. It took us 2 months. So I applied on the 6th of April for the accreditation, and I admitted my first patient on the 6th of June, 2 months later. It was a hard battle. And then recommendations, what will I say? Sorry, if you can please move to my next slide. The first thing I will say is to be exemplary. So lead from the front. Yeah, lead from the front. Somebody said to me, I'm sorry to say this here, but somebody said to me that Dr. Lossing, everybody kept warning him not to go to hospital. And he said, you can't ask others to go and not go yourself. That was my own position. I think you need to lead from the front. That's always been my leadership style. It has to be, by example, you have to be focused and not lose, very purposeful and fair to everybody. Then team working, something that happened that was very interesting during this period. A lot of innovation from my people. Certain people just suddenly emerged as leaders. People who were titular leaders took a back step to young, people who were very brave, very, very bright, who had, very innovative. And then roles became more important than titles. And then most important of course, is to stay the course. Don't get discouraged. Don't give up. Several times I almost gave up in those 2 months. But, I had various people who propped me up and helped me along the way. So, yeah. So here we are today, and I'm happy that, we are able to provide care. A number of people who have recovered. Erima is like Dr. Deloye. Because of my age, I don't go to Ikeja where the treatment center is, but Erima, who is on this team, is the head nurse there, and they're doing very good work. Many people have recovered and have been discharged, and they're doing good work. I'm also proud to say that the first patient in Lagos State to get off a ventilator alive left the hospital a couple of weeks ago. Thank you.
Thank you very much, Dr. Ngozi Onya. And that actually needs an applause because you took the bull. Yes, thank you very much. Thank you. We applaud you. You took the bull by the horn. You are fearless, bold, and thank you for the tenacity in spite of all odds, the financial and the other challenges that you faced. You still continued, and today you are one of the centers to be reckoned with. And one of the things that you have highlighted is the exemplary and focused leadership. We appreciate your great work. I would like to take a nurse from your hospital to tell us her own personal experience. So I will call on Mrs. Erima Nwama. She is a registered nurse midwife and she works at Belon Memorial Hospital. Please, can you tell us the challenges you face while taking care, the day-to-day care of COVID patients, and what personal strategies that you put in place to cope with these challenges? Mrs. Erima.
Thank you. Greetings, everybody, to the panelists and everyone listening on this forum. I'm Mrs. Erima Nwama. Just talking about challenges I face as a nurse in treating COVID-19 patients. It's basically maintaining an appropriate distance while caring for the patients, both physically and emotionally. And it's very, I would like to say, impossible. Because every shift, the management had made it possible that we are all covered up in the protective devices and clothing. And when you get in there, it's to prevent us from getting infected. But it has never shielded our hearts from getting affected. So I can speak for my team and I. Every day we put in our best daily, caring, chatting, dancing for the patients. Even my boss does that to brighten up their day. So many have been discharged, some transferred to other facilities, and some we have bid our final goodbyes. I would have loved to talk about a patient who passed on so suddenly. 1 minute she was stabilized on oxygen on 10 liters per minute, and we kept on going into her room every 10 minutes because she was critical. On leaving her room shortly, like 2 minutes later, she pressed the bell, and before we knew it, we had to start doing CPR for her, and we lost her. But while thinking of how to say that, I woke up on Monday morning and I found out that we had read the message saying that we had lost a favorite patient. And the patient was told, yeah, pardon me, we can't call names. She was admitted with us on the ward, very calm. You know, they come to you, that some of them don't present with the fever and all or breathlessness. But over time, when the course of the infection starts, they start to deteriorate. And so we had to move him to the ICU. And after every round, when you resume and we go on rounds, I would stop at his ward and I would tell him, so, you know, it's another bright day to tell God thank you. And he would smile and nod. And then I would sing a song, because I sang a song for him. Most times it's not about just caring for the patients and going in to serve them drugs. In Pelon, we don't do that. We like to interact with the patients that we see. So we are all protected. We go in, we chat, we ask you questions, we find out what issues you have during the day, and then communicate it to our partners, to our bosses online. And this particular person was a very cheerful man. He would sing along, "What a marvelous God." And I could see that it built up his hope. It made him, every morning, it became a ritual. I would come, I would greet him, and we would sing along. Only for me to find out that 2 days later, he relapsed, and after that, he was gone. I can never get used to it. I keep repeating, I can never get used to it, because it will mean losing some part of my humanity. But the coping strategies that I have devised between my team and I is to have a closer relationship with God. It just gives you sanity. It gives you a positive aura to go on with your work each day. So, and I also ward off the spirit of fear. So like my MD, Dr. Nya, said, on the first day of the lockdown, which was the 30th of March or 1st of April, she called everybody on the first floor and said, referred us to Judges chapter 7, 3-7, and said, who knows what that passage says? And I said, Gideon, the people that went with Gideon. And he said, if you're fearful, go back. And she said, yes. So it says, whosoever is fearful and afraid, let him return and depart early from Mount Gilead. And then she told everybody, you can take a leave of absence. And when the pandemic is over, the hospital will take you back. That got me thinking. That built up my courage, because before then they had provided masks for us and face shields. They had made a holding tent. So things were in place. She said everybody is scared. They don't want us to continue. And I'm like, well, I get my daily living from here, and I'm going to continue because whether we like it or not, patients will get infected with COVID-19, and we cannot all push them away. Also, I do the best I can for my patients. So when they come and they need help, we would attend to them within the best of our capability. And at the end of the day, I go home to my loving and supportive family, knowing that tomorrow is another day, and God daily loads us with his blessings. One lesson I would like to pass across that has kept me is to trust God to lead you, and you will never stumble. Trust God to lead you. I'm glad to work in an organization that value the staff members, and it has kept us going. They've never left anyone behind. So I trust God to do his best for us. We do our best and then leave the rest to God. Thank you.
Thank you. Thank you very much. Thank you very much indeed. You have with yours, and you have without doubt proven to us that the PPE indeed has never shielded your heart, even though it has shielded your body from the infection. Well, that has brought us to the end of our segment on the local perspectives and insights. And we have spent a lot of time, so we are going to go in. Please continue, let the questions continue to come, but we are going to move on to the next segment. That is the international perspective. And first of all, we are starting with Dr. Dapo Loye. Dr. Dapo Loye is a registrar at St. Helens and Knowsley Trust Foundation in the UK. Would you please briefly describe to us your work with COVID-19 patients in the UK, particularly under the NHS? Somebody said, Dr. Odumo said we don't have an NHS or equivalent in Nigeria, but maybe you'll give us some perspective on that, and we know how to go about it. And we would also like to hear from you the major problems you face and how you overcome them. Thank you, Dr. Loye.
Thank you very much for the opportunity to share this panel with such distinguished people. I will be providing not just the perspective from outside Nigeria. I'll be providing a perspective from a junior doctor who is in training. I am presently a GP trainee in the UK, and I'm still undergoing my hospital rotations. So I am in the ear, nose, and throat department, and I've been in this department since the pandemic started. The ENT department, unfortunately, is one of the high-risk departments because considering the fact that we have a respiratory illness, and your job is to look up the nose and look down the throat of different patients, it puts you in an uncomfortable position and at risk. So my job basically is one of more of a junior doctor, and it involves day-to-day care of patients, daily ward rounds, and also reviewing with more senior colleagues and following up on the plans. And also as a junior patient in ENT, I'm the first on call, and you get to see these patients as they come into the hospital. And whether or not they have, some of the ENT conditions might mimic some COVID-like symptoms, and it might be difficult to differentiate between the two until you have a confirmation from the test. Also, at the peak of the pandemic, I had the opportunity of course covering for my colleagues in medicine and I worked on the COVID ward for a few days. And at the time, the protocol was, and it's still managing the patients symptomatically and optimizing them medically, and ensuring that they are up to, that you're giving them the best chance to recover and allowing their bodies to, their immune systems to take over and heal from the COVID virus. I would say during my experience in the COVID wards, there is a lot more freedom in making inpatient management, and a lot of the protocols that were changed at the time of the peak of this viral pandemic. And you had the opportunity of making decisions regarding the patient's resuscitation status, which was previously reserved for consultants and very senior registrars. So that has been my job description since starting, since working during the onset of this COVID virus. I would say the thing I appreciate about the response here in the UK is the prompt response to the guidelines, treatment guidelines. So there was a drive, a very strong drive, both on the TV and generally to keep patients out of the hospital, except absolutely necessary. And also the treatment guidelines on ENT were revised. So in a lot of cases, you have to look down the throat, you have to look up the nose, you have to perform aerosol generating procedures that make patients cough or sneeze on you. So there was a revision of these guidelines as regarding what to do and what not to do. Obviously, there is the consideration of patient safety in making these, but one can appreciate the efforts that went into protecting both the patients and protecting the health staff. One of the issues that came up was the inconsistency in some of these guidelines in different departments. So I would say in ENT, because we were recognized as a high-risk specialty, there was adequate provision for PPE for all ENT trainees and all the doctors in the ear, nose, and throat department. And the interesting thing was when I was cross-covering on the COVID ward, I were not provided that same level of protection. I know this has been looked at and adjustments have been changed, have been made to all this, but that was an issue at the peak of the pandemic. Also, as I said, I'll be giving a junior doctor a trainee's perspective. So from a trainee's perspective, my training was unfortunately affected. They usually have weekly classes which had to be stopped because we needed to stop mass gatherings. And also a lot of the processes and the clinics I needed to go into had to be cancelled because you needed to restrict patients coming into hospital. So my training was unfortunately affected. We've made provisions to try and have remedial courses after my posting in ENT is over. Also, there was a lot of anxiety. I know this has been said a lot, but there is a lot of anxiety both from the patients and both from the healthcare's point of view. Because once these protocols have been changed, you don't want to be the doctor who would miss something very glaring or something very dangerous in a patient. So at the early onset, when the protocols were being revised, there was a lot of anxiety regarding patient safety. Thankfully, we had enough support from the senior medical community who gave us a level of protection regarding the decisions we made at that time. And burnout syndrome has been mentioned. At a point in time, about 4 of my colleagues had to self-guide. Had to stay out of the hospital because they had fever or they had 1 or 2 symptoms. And you had to cover the basis. You had to cover for those who were absent at that time. But also what was done was to employ more junior doctors. So at the time, we had a lot more doctors employed into the department to try and cover for the shortfalls. So all in all, it's been a positive response from those in leadership. And I can come to appreciate listening to my more senior colleagues and looking at the responses of those who are in leadership positions in private hospitals. I can appreciate how much effort that goes into making sure that your services don't stop, and also protecting your staffs and protecting the people you work with. And that is something I can reflect back on working as a junior doctor here in the UK.
Thank you very much, Dr. Dane Loye, for giving us the perspective from the NHS. One thing that stood out was that you were adequately protected with PPE provision. You didn't have to worry that you didn't have enough PPEs to use. You didn't, and there was prompt response. And like I said earlier on at the introduction, the COVID pandemic has increased the disparity in access to quality healthcare between regions. And, we know what happens in the economically less privileged countries like Nigeria. So, but by and large, I think there should be a barest minimum availability of PPE for any doctor, because the healthcare worker has to be alive anyway for healthcare delivery to be given. So with that, let's come to our next speaker. It's my pleasure to welcome Dr. Sunlola Adekoya from the US, Virginia State experience as a medical director of the Community Health Services of the state of Virginia. Could you please kindly describe to us the major strategies that your state has rolled out to combat COVID-19? And in the light of the experience you have had, how do you continue to deliver quality healthcare services? And you may want to wrap up by telling us some of your own personal resilience fallbacks.
Okay, thank you. Can you share my slides, please? I just want to say good morning, good afternoon to you all. I'm Dr. Adekoya, and I work as Community Health Services Medical Director with the state of Virginia. So I would say that just hearing your stories just makes my heart bleed, because we are very, very fortunate here in Virginia, and but still, we still had our own share of the challenges that we had. If any of you know, our governor is a physician. So having a physician as a governor was really a blessing. And prior to the COVID-19, we really had ramped up our emergency preparedness division. After 9/11, the US government created a division of emergency preparedness. And so we have a whole office that is set and ready to go. So prior to COVID, we normally have routine drills that prepare us for such a time like this. But nevertheless, we weren't expecting this magnitude. So the first thing that the governor did was that he declared a state of emergency due to COVID-19. Also, during the period of emergency, most of the emergency division in the United States will use what we call an incident command structure, where you have different divisions and you all come together. But due to the nature of the pandemic, we all came under a unified command leadership structure, which means a lot of the big five state government agencies came together under one leadership. So we had the Virginia Department of Health, we had the Virginia State Police, we had Virginia National Guard, we had the Office of Attorney's Office, and we had also Virginia Department of Emergency Management. So we all came together under the leadership structure of the governor. The governor, being a physician, was really crucial in different state departments working together in a collaborative manner. So the importance of partnership, the importance of collaboration, the importance of, being prepared prior to this. We're lucky we have, state-of-the-art technology. So right off the start, the governor was able to put in place quickly the Executive Order 55, which means the stay-at-home order. So we had a lot of public health messages going out, closing the schools of higher education, closures of beaches, canceling all gatherings. You were only allowed to have 10 or less people in a gathering. So that really helped us to, halt the spread of infection. And also we were able to put in place quickly testing and initial phases of the pandemic. We had issues with testing like anybody else did. We had to send the test down to the Center of Disease Prevention in Atlanta. So our state lab was able to quickly ramp up testing. And then we also had to accredit a lot of private labs. So we knew that testing was key. We also, as of today, we've conducted almost close to 1 million tests. We use the PCR and also have an app that anybody in wherever you are in Virginia, all you have to put in is your zip code, and it comes up in your phone or your smartphone, your smart device that can really inform you of the closest testing center. So if I need, somebody needs to test, they have symptoms, all they need to put it on their smartphone or their device is their zip code, and find out where the testing is. So we knew that testing was critical. We needed to ramp up testing quickly. We were also fortunate to be able to get funding from the federal government. We got the CARES Act, which brought in millions of dollars to the state, and being able to really provide funding for those testing. We also realized at the initial phases of the pandemic, we had issues with PPE, a lot of supply chain management. A lot of the PPE came in from outside of the country, so all the states were beaten. But because we had an ample supply prior to this, we were able to use what we had in storage, but then we had to work with other states to really bid in for supply so that we ensure that our hospitals had enough PPE, our long-term care facilities had enough PPE, congregate setting, our long-term homes. So initially at the onset of the pandemic, one issue we had was we had a lot of outbreaks in the long-term.
COVID-19 may kick your system.
Excuse me. So we had a lot of outbreaks in the long-term care facilities. So really being able to conduct testing in those care settings and provide adequate PPE was key.
Thank you. Thank you very much. Would you like to take 1 or 2 minutes to wrap up? Or are you done?
No, I'm not done. Next slide, Tolu.
Please, could you wrap up in the next one minute or so?
Yes, I would. So moving forward, Virginia has been really, if you look at this US, Virginia, you can see our colors are a little bit lighter because we've really been able to put a containment effort. We have enough contact tracers that conduct tracing. We also have continuous public service announcements that puts in place the importance of wearing face covering. We've had issues in the US where wearing face covering has become a political issue. So our governor has really been encouraging everybody to put on a face covering. We already have a mandate to put on state covering. And Virginia has been able to use our signs to influence our policy decisions and reopening. So just to wrap up, I think it's very, very important for, at least talking from, my state in Virginia, to see the importance of public health messages, to take it seriously, and to see that as we move forward, our new normal is wearing a face mask, following the instructions of the public health officials as we begin to think of reopening our schools, our businesses, which is important for us as we move forward. And if nothing else, for those who are in the United States, please take it seriously. Follow your public health officials, wear a face mask when you're out in public, social distance, wash your hands, use a hand sanitizer. It does save lives. Thank you.
Thank you very much, Dr. Adekoya. That was brilliant. You were able to fill in even though Lagos State was prepared, like Dr. Mitiu told us, they found that they were only 60% prepared, and you were able to give us a picture of what it is to actually be fully prepared, including doing some drills and the use of technology, using phone apps for testing. Thank you. We still have 2 speakers, and we are going to quickly, we have spent a lot of time. It's been very interesting, but we have to take an exciting aspect of this from Mrs. B.C. Bright, who is a pharmacist and a director of an NGO. It's our pleasure to have you come on, Mrs. B.C. Bright, to recount your experience with building capacity, building the resilience of healthcare workers by building their capacity. Would you like to, come on to the floor, please?
Yes, thank you. Good afternoon, everyone. I'd like to share my screen now. Or maybe Tolu can kindly put the slides in for me. I'll appreciate that. I'm actually disabled for screen sharing. Tolu, you could either activate me or share.
Your slides are already on the screen.
Yes, I can see them.
Next slide.
Yeah, thank you. Yeah, so we're talking about COVID-19 resilience at the Live Well Initiative. The Live Well Initiative is a non-profit organization based here in Nigeria. I want to thank the foundation for the kind invitation to this speaking engagement. We are happy to be working and collaborating with your organization. So the Live Well Initiative is a non-profit organization based in Nigeria, but we have an international outlook, and we are actually a registered and active member of the United Nations Global Compact. Next slide, please. Next slide, please. Can you put in the next slide? Thank you. Yes, thank you. So talking about resilience, COVID-19 resilience just has to do with your coping strategies, your mitigation strategies, and so on. And within the Live Well Initiative, it's a very broad scope, but I've tried to narrow everything into this one slide because I was told we would have only 5 minutes. So this is the main slide of the presentation. Everything else is. So we designed study protocols for COVID-19 response. And these protocols were designed prophylaxis as well as treatment of COVID. And we've shared this with state governments, with the private health sector, and the public health sector. And a lot of organizations are working with us, albeit quietly. Dr. Demola Dinloye presented. He's one of the physicians working with our protocols. And within the government, we have the Kaduna State government, the Bauchi State government, Kwara, Katsina, and so on. And there are a lot of other private sector organizations working with us. And we've gone into the stage of preparing now to go into randomized clinical trials with a lot of collaborators. We want to do a phase 2 clinical trial of the protocols because they are really working. But we only share the protocols with organizations that are interested in moving forward with the COVID-19 response. And it has to do with resilience, really, especially when you're working with protocols that probably are not even, everybody is guessing anyway, but these are protocols that are not yet proven, but they are working. And we've done quite a lot in that area. We do have a few international partners. We had 1 or 2 webinars in which the UN, the Mayo Clinic, and even the WHO participated as panelists talking about the protocols. We also looked at responding to COVID-19 positive tested patients. I want to thank Dr. Muti for the great work he's doing. We are happy that at the Live Well initiative, we have a few frontline officers. Two of them will be speaking today, very briefly. They're working, one of them is actually on site at an isolation center in Victoria Island right now. There are a few of them there, but one of the speakers will be speaking from the isolation center. And they are the ones at the battlefront, like Dr. Onya said, the real experience. And when Dr. Mutiu mentioned that sometimes you can't see your family, he's very right about that. There's something blocking the screen, yes. Then, so I'm dealing with COVID-19 positive tested clients at the isolation center. We are also dealing with non-COVID patients and clients. We've set up this telehealth service, and the telehealth service is kind of divided into, we have the emotional health respondents, and there we have 3 of our psychiatrists, our emotional health specialists, who pick calls and attend to people who are suffering from anxiety or have issues that COVID and their emotional health is a bit unstable or needs attention. Then we have people who just they don't know where to go. I know that was a client that was rejected by so many. So we have a telehealth service that to channel people to the right place where they can get care. Working in the low income areas of the community, in blighted areas, Makoko, and so on. And areas we are working primary healthcare with the PHCs. We actually resilience one of the locations recently, and we found that the people are not using face masks. Believe that COVID-19 belongs to rich people. It is an illness for rich people, and it's their business. And so in the low-income communities where you have indigenous people, they are asking food, saying that food is not the nose covering. Can I have the next slide, please? So the next few slides will also show a few of what we've done so far and how it looks. Please, can I have the next slide? Thank you.
Please, could you wrap up in the next minutes or so? We don't really have so much time.
Tolu, please, can you?
You have spent about 6 minutes.
Yes, I've moved over onto the next slide. That's slide 3.
No, I need the next slide. I need the picture. I have only pictures, so I can.
Mrs. Bright, would you like to round up in the next 60 seconds, please?
Yes, please. Tolu, please go to the slide that has the officers in front of the Makoko set. Okay, that's those are the officers at the front line. That's the one at the front treating patients. Please just go to the slide. Conclusion. Thank you. That's Makoko, where you see that it's only a routine wearing the mask, and the people there are not wearing masks. Please, can you go to the final, which says conclusion? Please, thank you. Yes, thank you. So, in concluding, I'll just quickly say that COVID-19 resilience community need assisted health-wise, psychologically, and we continue our initiative to on all fronts, and we hope mental health would reach out to the community health organization. So COVID-19 will be better impacted within the communities, and the people we get to understand that COVID-19 is. Thank you very much. Thank you, everyone. Thank you.
Thank you very much, Mrs. Bisi Bright. it's very heartwarming to find that we have NGOs who are really in the front line helping our healthcare workers, particularly in the area of emotional health. That is something that we all need to pay more attention. Dr. Mutiu also talked about psychosocial support. I think every hospital should make provision, whether private or public hospital, should have provision for psychosocial support and address emotional problems amongst healthcare workers before they get out of hand. Thank you. We applaud your excellent work and note that your NGO is doing well. I think we'll all want to go and visit your website after this time to see how we can benefit from it as a healthcare worker. So I think we're going to take just one more person now because of our time. Can we have Mrs. Abigail Peterson come on? She is a nurse. The nurses are very critical in the frontline battle for COVID-19, and our nurses are always there at all times. They spend longer hours, but we have taken an example of a clinical nurse, but there are also nurses that do work by conducting health education programs. So Mrs. Abigail Peterson, could you come on and let us know what you are doing and what the principles of home care as well? Would like you to comment now. Thank you.
Will you please share her presentation?
Abigail Peterson,
I
is
just
she
want to
unmuted?
make sure that she's that she is unmuted.
Well, while we are waiting for her,
maybe she could raise her hand.
While we're waiting for her, I'd like to say that we've had very exciting discourse in the past couple of hours when we started this, and we are very happy that we had the local perspective, and then we saw the deficiencies in our system, the preparedness that we thought was optimal, that really wasn't. And then we saw an example of one that came from Virginia. It's nice to hear that in the US, because the US, it's been, the picture we see from the media has been really very bad. They see that Virginia stands out as an example of a positive trend in the fight against COVID. When Mrs. Abigail Peterson comes in, please let me know. I'm just trying to fill up the time before she comes in.
Oguni will be speaking on her instead of her.
Okay, so Oguni, you ready now? Before.
Frontline officer. He's at the isolation center and he's willing to speak now. Thank you.
Okay, all right then. So we take Oguni. Oguni, would you like to share your experience? Mr. Oguni, a nurse?
Okay.
Or...
I'm a nurse. I'm a nurse.
Yes, very good. Thank you very much. We wanted the nurse represented. Yes, thank you. Please,
Okay.
can you share your experience and tell us about your challenges as well?
Okay. Good afternoon, everyone. Can you hear me, please?
We can hear you. Please.
Okay. Good afternoon, everyone. It's a very big privilege talking before my people here today. Well, working at the isolation center has been a very good privilege opportunity for me, which has built more resilience in me. Any day, anytime I find myself in the front line, I really salute myself for that, because it's not an easy task. But I decided to respond to this call, because I was called. I remember I was called 2014 for Ebola, and when I got to the site at Nasarawa, when I look at everything, I can't stay. I have to go back. But this time around, I tell myself, I said, no. A soldier not going to war, I don't think that is a very good one. So I decided to pick up the call. And when my boss, Mrs. Bright, said, "Are you ready?" I said, "Well, I'm ready. I'm really ready, and I think I'm prepared." On getting to the front line, it's not what I'm looking at and that I found it, but really, as a medical practitioner, you need, as we said, resilience is not what is born with, and is not an inbuilt. You have to develop it, which I try as much as possible to develop mine, to meet up with the standard and to make sure I fit into the system which I found myself. It's not an easy task. I even come in late because we have a patient which has been going up and down since in the ICU. So I have to stay back and make sure he's fine before I come out. And being here today, it's a very big opportunity, which I think I expect everyone as a medical practitioner, especially we nurses, backbone of medical life, should be here today, as in be at the front line, try as much as possible to be there. You see, and the challenges we've been facing is about, patient coming in. Most of our patients here, almost half of them are Indians, so they come in with some challenges of vegetarians and some other things. They don't eat our food, so we need to reassure and give them what we have to offer them. And with God, they've been with us since we have started this isolation center. That have been here. None of us as a contact has been positive to COVID. I think that is one of the reasons I'm still happy for today. So many challenges here and there, but we are given a very good opportunity to be with a psychotherapy, which has been helping us to build more resilience, to build more, to let us have this hope that we are going to survive. We share our thoughts, we share our thinking, and we share so many with ourselves. We build so many more of resilience within ourselves. So I believe if we have more of the nurses on the front line, which I know most of us are trying to be there, to have an opportunity to work at the front line. But maybe because of the level at which the country is now, I think maybe money, maybe I'll say management and some like PPE, high rate of use and some other things. Maybe that is why. But I believe some private hospital more are coming up with their own isolation center, which I know more nurses will be recruited to assist, because the truth is we nurses do more in this COVID situation. We need to console, we need to psychologically talk to our parents, our patients, and even give more advice. And we ourselves, this give us and boost our confidence in some areas. Because if you have not been to this kind of war, I don't know which one you want to be in. This is a very big war that is affecting the whole world. This is a massive war for everybody to be in. We need to fight. And I believe, as a medical personnel, as a nurse, I believe we are going to conquer, because you might be infected, yes, but we believe and we know that nothing is going to happen. You will survive it. So for everybody that is coming in or that is still planning to come in, that are on board, we all know, or we should have it at the back of our mind, that no matter what it is, we are going to come in and we are going to be fine and nothing is going to happen. Building resilience it has been what Live Well initiative have been pushing to us right even before the COVID. We have been having some conversations, meeting with other people, having series of meetings with other organizations, which has been helping. And I think that is the best thing every organization has to go in with. Can I go to the next? Can you have the
Thank you.
next slide?
Thank you very much, Femi Oguni, I
Yes.
think you have said it all. You have encouraged us all, particularly the nurses, and you have warned us that more COVID centers are coming up. I'm sure Dr. Onyai will be happy to know that other colleagues in the private sector will soon join as well. It's been wonderful hearing from us all. There are loads and loads of questions that have been sent in, and I think it would be nice for us to take some of those questions. The famous talk is that feedback is the breakfast of champions. If you want to be champions in the field of working, in the field of building resilience to work with COVID-19, then we must get the feedback from everyone. So I'd like us to take some of these questions, but before we take the questions, I just want to say that all the speakers, all the panelists have done extremely brilliantly and very well. We salute you all. We thank you for sharing your experience, for telling us the challenges you have had, and for helping us to develop. But I personally, I have benefited. Ngozi, so despite being bold, being focused, and also being innovative, she did not throw caution to the wind. She told us that she doesn't go to the Ikeja isolation center. I felt glad about that, because I am constantly being told to get away from my ward and not to go in. And sometimes I really actually feel guilty. But today I know that you have to fight fully armed, and fully armed with PPE and all that. And if there are comorbidities, if you have risk, we have to do triaging. Triaging for our patients, triaging for the healthcare workers as well. If we take away our healthcare workers who have comorbidities away from where they can easily get infected, then we'll have more people supporting them from behind, like the real generals in the battle. So thank you very much, everyone. And can we go to the questions now? Do we have questions that have been lined up? I can see that the chat is full of questions. Tony, would you like to read some of those questions out for us?
Elizabeth, just take about 3 questions, and that's all. Time is going.
Hello, can you hear me?
Okay, Tony, yes, can you let me have the most, some of them are repeated. Can we have the,
okay.
Can we have some of these questions?
Okay, there are questions about, can you hear me, please?
Yes, we can hear you.
Okay, so we have questions on testing in Nigeria. Someone wants to know why despite the comparatively lower prevalence of COVID-19, will the EU and the UK not exclude Nigeria in their travel ban? Is it because we are not doing enough testing for the size of our population? Another question on testing was, why are the results not communicated to patients promptly, even when positive? And then we have another one that says, I think that's for Dr. Mutiu, your lab does PCR tests, whereas most private labs are doing antigen antibody tests. How credible are these private labs?
Thank you very much.
Questions on testing.
Yes. Dr. Bamidele Mutiu, would you like to address some of these questions? Most of them are for you.
Thank you very much, ma'am. The first one concerning EU, excluding Nigeria, I may not be able to answer that one. I believe that one is more political than the status of COVID-19. But concerning the result not being communicated to people, I believe this pandemic is a learning experience for all of us. Nobody has ever experienced anything like this. We started with contacting only those who are positive and bringing them, because we started with containment. Later on, we move on to the issue of, okay, these are asymptomatic, we can leave. So initially, we're not even communicating negative results, only the positive that we are going after. But after some time, we discovered that medicine, you cannot do it without ICT. So we now had to look for data clerks. Even for my lab alone, I have close to 15 data clerks, so that we're able to generate the results and send to the people. And then the issue of people being honest. Some people will put their friend's phone number so at the end of the day, when you send the results, they don't get it on time. Then email addresses was a major issue. Some people, the way they wrote the email addresses, but now at least sending results has been better. Concerning RDT, as far as Nigeria is concerned, no rapid diagnostic test kit has been validated and approved for use. Any lab doing that is doing it at a great risk. For Lagos State, we have a governance structure in place. We have validated 7 private laboratories, and all of them are doing PCR. Every validated laboratory in Lagos State are doing PCR. There was a time one private laboratory was running RDT. The laboratory was closed down. Any laboratory that does RDT and we get to know, the laboratory will be shut down in Lagos. Other laboratories that will still be coming above will be doing PCR. All of them are PCR-based tests. Thank you very much.
Thank you very much, Dr. Mutiu. Could you expatiate a little more on the risk of using the antigen tests and antibody tests instead of the molecular tests? Because we all know that in the time of HIV, we did have screening tests and then confirmatory tests. We know that the sensitivity and the specificity of these tests are reduced compared to the molecular one. But in our own context, where we don't have enough tests to cover the populace, and we actually, I mean, it's like for one positive test, there are probably 100 out there, not yet tested. Would it not be wise to use some of these tests as a screening test and then do confirmatory? What is the danger in doing this? Could you let us know why, as the government, been adamant about not allowing these tests?
Thank you very much, man. It's because in RDT, you may have positive, you may have negative. For those who are negative, if it is false negative, the tendency is that the person is positive. And then if the person, for example, I can give you, there is one big organization in Nigeria as of now that they have outbreaks on almost all their platforms because they believe in using RDT. And inadvertently, they've allowed people who are positive, whom the test kit picked as negative. And with that, we now have outbreaks in different locations in Nigeria. RDT, if the people are not traveling, if they are within Nigeria, at least we're able to follow up within a clinical context, we may still be able to use it. Unfortunately, Lagos State Biobank, where I happen to be the director, have validated close to additional validation tests on about 8 RDT, and none of them has been able to pass. Antigen-based, antibody-based, all of them are failed. When it comes to picking positive, they'll be able to do a bit, but when it comes to picking negative, sometimes what they pick as negative turn out to be positive on PCR. So it's a major challenge. So for now, that is why we now decide we expand to the private laboratory to do PCR so that as many people are able to gain access to testing. Thank you, ma'am.
Thank you very much. There is a question that says that what is your take on the use of hydroxychloroquine, AZT, and zinc for treating COVID? Dr. Onya, would you like to talk about that? Somebody did say that WHO has banned chloroquine, hydroxychloroquine, and we are still using it. Would you like to make comments on that? Dr. Onya? Dr. Onya doesn't seem to be here.
Yeah, sorry, but I'll put on my camera in a minute now, my video in a minute. I think my stance on treatment, somebody has, I think it was Mrs. Bright who had said earlier, there's no proven therapeutic medication for COVID, none anywhere in the world proven. Even remdesivir is still not proven. However, we know that the highest level of evidence is randomized controlled trials. None have been conducted so far. So the lowest level is expert opinion, and various experts all over the world have tried various things, and they think they have worked for them. So that's what people are using. So I don't judge whether hydroxychloroquine is good or not. If I caught COVID now, will I try hydroxychloroquine on myself? Yes, I will. I will not just stay and not do anything. That's the honest truth. Until we get a proven therapeutic drug for COVID. I think people will just have to keep winging their way through and somehow we will survive. Members of my family, my 2 children have caught COVID, and yes, I have treated them with some of these touted remedies, and they recovered. Will they have recovered without medication? Probably, but they recovered, and I'm glad.
Thank you very much, Dr. Onya. I will just end the session by answering to a question that was sent in by one of our retired directors from the Federal Ministry.
Yes, sorry, Prof.
Federal Ministry of Health. She wanted to know this. Yes, can I? Yeah.
Sorry, Prof. I wanted
to interruptions there.
Because that's what our protocol is all about. I mentioned it when I was speaking that Dr. Demola Denloye has been using those protocols. We have quite a lot of state governments that are using those protocols, and like I said, there's no proven cure for COVID-19, but these are repurposed drugs that are being applied and they're working. So in answering that question, I'll say yes, it's worth trying it, but you shouldn't use it on your own. You talk to your doctor, and then that's my take on that. And the LWI protocols, we are going into clinical trials now. So we are hopeful.
Thank you very much. Thank you very much. Yes, Mrs. Bright, thank you particularly for bringing on the aspect of research. Research is critical because we need to contribute from all we are doing as healthcare workers. We need to contribute to data collection on COVID-19 so that we can know what the outcomes are in our patients, whether they are young infants, whether they are children, or whether they are adults. We need to begin to collect data. So whether we are in the private hospital or in the government centers, data collection is key. And answering the question that I brought up earlier on about strategies, to put in place in this COVID era as regards maternal newborn child health, we have to ensure, number one, is very critical, ensure that we adequately protect our healthcare workers, because without them, there is no healthcare. We have to use protocols. A lot of people had mentioned protocols right across the local to the international panelists. They all talked about protocol, and Mrs. BC Bright is doing a lot in even trying to use the research to see which of these protocols are actually working. So we appreciate that. Then we also will not forget the triaging. And triaging, we need to know that a lot of people, like 70% of the healthcare workers who have been infected, were actually asymptomatic or had very simple symptoms. So we need to find, those people that are symptoms, not only patients, but also healthcare workers. We have cases of infection amongst in my own department. And we found out that, doctors were actually transmitting these viruses amongst themselves. And once we did capacity building and retraining, talking about IPC strategies, we found that the rate of infection went down completely, but we thank God that they all recovered. So maintaining, a triaging system and removing, obese patients, obese healthcare workers, those who are hypertensive and who have diabetes from being infected is very critical. And we must not forget that we have to maintain monitoring, surveillance for diseases, and even delivery of preventive care, particularly for mothers, for pregnant women. Ideally, it would be nice to have all pregnant women screened for COVID-19, but that is not possible unless the testing capacity improves, as Dr. Mutiu has assured us it will improve. It will be nice, but while we are not able to do that, we must, exercise a lot of caution and also educate our patients. We need to educate our patients, the parents, and ensure that they know what is happening. So we have to be sensitive about the healthcare workers and have special updates and continuous training. Dr. Mutiu talked about capacity building, continuous training for all of them. So resilience is as much about building systems and protocols as it is about building people's capacity. Many of us raise the importance of building moral and providing psychosocial support. That is also very important. Resilience in this pandemic requires multi-stakeholder participation. Right from the government has its own part to play in providing and protecting the healthcare worker with PPE. And I like the way Wamara says it, we should not cover our hearts with the PPE, it should shield our body alone. And then, down to the MDs, what you have to ensure that protocols are in place, SOPs are in place, and you are, providing encouragement and also psychosocial support, emotional support for your workers. So we need to be doing this effectively. We need to coordinate it, have clear communication of the needs and protocols. And, the last but not the least, I want to reiterate the need for innovation, importance of data collection so that we'll be able to generate our own proper, guidelines and treatments. So thank you very much, Dr. Odumosu. I'd like to hand over the floor to you now. Thanks for the opportunity. It's been a very exciting one. Thank you.
Thank you, Professor Disu, for taking on that task. Tolu?
Yes, I'm here.
Please, can you just unmute everybody and we give the panelists and Professor Disu a round of applause just for 1 minute? Just unmute everybody.
Well, I can't unmute everyone, but I can certainly allow everybody to mute themselves. So everybody can unmute themselves now.
Yeah, and keep them and keep unmuting. Please, can we just give them? Thank you. No. Thank you. Can we bring it down to a closure? Okay. Thank you. Thank you. You've all done excellently well. And I just want to thank everybody for the work that you've done. You've all done very well. And really to now apologize for the numbers that we've had. We had an issue at the beginning with people coming in, and it was a technical issue, so we do apologize. So you will go back, a number of you will tell you that, oh, they couldn't join. At nearly 300 people, 283 people registered, and in all, we only had about 125 people who were able to join, because for about 10 minutes or so, at a critical time, after 100 people joining, there was a disconnect, and then we had to sort of, that was solved. So but for those who have stayed with us this time, we say thank you very much. So we are now going to go into the thank you session, because as we said, the applause we've given is to the facilitator and the panelists. Now we're now going to go into another second round of applause to thank all the health workers. I know that 90% of the people who are participating as participants are probably health workers as well. And we want to say thank you to everyone for doing a good job, and to all your staff in Palion, to all your staff in LifeWell, to all your staff in Loop, to say Loop staff, who else is there, to the staff of NHS Trust, everybody. So this applause, this thank you is going to go to them. Now this thank you session will now be led by another professor in the house, Professor Kayode Denloye. So Professor Denloye, please lead us.
Hello. Hello. Good morning, good afternoon all. On behalf of Kedari Teleproof Foundation, I want to thank everyone for coming for joining this webinar. But I must thank in particular our panelists who have done such a great and wonderful job. I thank every one of them. I'm not going to mention everyone by name because time is well spent. We thought we'd wrap up in 2 hours. It's well past 6 now. So I thank all of you. I also want to thank all those who have attended, contributed, all those who have submitted questions. Thank you all. Of course, we also thank Almighty God for making this day a reality, for making it possible to gather like this. Of course, Professor Elizabeth has given us all we need to go on with. I mean, the great lesson is, of course, COVID is very, very real. Resilience is important. We need to do the right things. We need to observe, follow the protocols. And if you are sick, try and seek medical attention. I want to thank all those who have contributed from the private sector, from the public sector, the nurses, the doctors, the pharmacists, giving perspectives from different angles. So I thank you all. It's been wonderful past 2 hours. So thank you all.
So we need to clap. We're going to clap again, please. We need to clap. This round of applause is for all the health workers. All for doing a fantastic job. All the health workers. All the health workers. Doctors, nurses, pharmacists, coordinators, administrators, and even the cleaners. Hooray, hooray, all the health workers.